Is my penis normal? I can't even count how often I hear this question in my clinic. I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to discuss average penile length. So, what actually determines penile size? The biggest factor is genetics, though environmental and hormonal influences can also play a role. You can watch my video about increasing penile size, but the truth is, there are very few methods that are both safe and truly effective. Still, toward the end, I'll share a few simple tips that may help your penis look slightly longer. Before we get into numbers, it's important to understand that measurement isn't fixed. Size can vary from person to person, and even within the same person depending on arousal, temperature, or anxiety. Over time, changes like lower testosterone levels or reduced blood flow, due to conditions such as high blood pressure or diabetes, can also affect size. All right, let's get straight to it. What is the average penile length? To answer that, we first need to clarify, are we talking about erect or flaccid length, and how is it measured? The largest study available combines data from 20 different studies, covering more than 15,000 men. Measurements were taken in both flaccid and stretched states, and interestingly, research shows that a fully stretched penis closely matches erect length. Measurements were taken from the tip of the glans, the very end of the penis, to the pubic bone where the penis connects, after pressing in the fat slightly. This is done along the top side, known as the dorsum. Measurements were recorded in flaccid, stretched, and sometimes erect states. They also measured circumference, meaning the girth, either at the base or the midshaft of the penis. Importantly, only studies where measurements were taken by trained medical professionals were included, because as you can imagine, if someone is measuring themselves, there's a natural tendency to overestimate the numbers. These studies also excluded men with penile conditions such as Peyronie's disease, plaques, curvatures, or similar issues. What they found was that the average flaccid length is about 3.6 inches, or 9.1 centimeters. When looking at stretched or erect length, the average falls between 5.1 and 5.2 inches, or roughly 13.1 to 13.2 centimeters. For erect circumference, meaning the measurement around the penis, the average ranges from about 3.6 to 4.6 inches, or approximately 9.3 to 11.6 centimeters. In one of my older videos where I reacted to scrubs, I reviewed a study focused mainly on Caucasian men in the UK, and the results were very similar. However, when you ask men what they believe is average, most will say around 6 inches. Because of this, many people assume they should be above average in length. If there's one key takeaway here, it's that penile length is not the ultimate factor in sexual pleasure. I've made many videos discussing pleasure and female anatomy. And if you've seen those, you know that women experience most of their pleasure through the clitoris, which is anatomically similar to the penis. It may look different, but structurally it's quite alike and mostly located inside the vulva. While having a larger penis is often emphasized as very important, it's actually not the most meaningful factor when it comes to pleasure. And it certainly shouldn't define your self-worth. A simple tip is trimming or removing hair in the pubic area, which can make a noticeable visual difference. Losing weight can also help reduce fat in the area above the penis, allowing more of the shaft to be visible. In the end, focus on pleasure, not size. But if you were looking for the numbers, now you have them. And as always, take care of yourself, because you matter.